What's up, folks? Guerrilla Radio episode 20, back with Dr. Nagel, part 2 of our Fixing Low Back Pain series. So, episode 1, we talked a lot about kind of mechanism of injury, what's really going on, why are we getting low back pain. And then step 2 is going to be all about screenings and assessments, and this is really Dr. Nagel's wheelhouse. He's going to jump into what he's looking for when he gets new patients in. It's going to set the stage for what we do in the next couple of videos, and then how do we treat it. So, let's just start with that. Let's jump in. Somebody comes in low back pain. What's the first couple things we're looking at? What are you looking for?
So there's multiple screens. We talked about like x-ray analysis and stuff like that, more like deep clinical stuff, but in the fitness realm or functional realm, there's some simple screening processes that the devil's in the details with. So this is something I'd encourage you to get good at studying. It's not something you're going to like jump on real quickly and be a master of, but as you get repetition looking at it, you start seeing simple patterns. So we're going to run through some simple mechanics stuff, starting with the core. Like everybody talks about core, the CrossFit world, you talk about midline stability, but I want you to understand what it means and how to screen not just strength, because strength and stability are not the same thing.
Strength, but not the same thing.
Right,
okay.
So stability is more of a neurological pattern. Is the pattern fire properly? If it fires properly, then you build strength and endurance in that pattern. If it doesn't fire properly, if you're in a compensatory pattern, and all you're doing is training, you're training the dysfunction, right? You're getting stronger and building more endurance into the wrong pattern.
Yeah, I think that's a huge thing to be focusing on today, because I think it happens to so many people, right? They can compensate, they can get through a certain movement even though it's not perfect, and then they think that they're getting better as they continue to do it without fixing the actual problem, just making the problem worse.
Right, and sometimes as a coach, they can look perfect, and so as coaches, I hope this is a good tool to learn how to screen people too, because there's some simple hands-on stuff that you can do to get rid of a lot of stuff. So the first thing we're going to talk about before we go in through hip mechanics or scapular mechanics or head and neck position, we're just going to talk about core mechanics and specifically the abdominal coordination. So what core stability means to us in the clinical world is that the entire core fires as a unit. Meaning that when you look at all the different musculature around your back, around your sides, around the front of your abdominals, including your pelvic floor diaphragm, they should fire as one unit. And when that happens, it creates pressure in your abdomen, right? Anybody that knows how to use a weightlifting belt knows what I'm talking about. When you contract against it, you feel rigidity in your spine. When you don't have that, we tend to see a bias towards using the quadratus lumborum, the large lumbar spine muscles, and rectus muscles. And there's a very common pattern we see. So I'm going to start with that. I'm just going to show you a simple screen tool. If you hop up here on your back, and this is going to be harder to see, but I'm going to explain what we look for. So just doing a simple, just telling you to simply look at your feet for me for a second. And when I do that, I can look, and oftentimes you'll see a humping right through here, or even a full diastasis. And what that means is that the rectus muscles have actually separated, and and you're pushing through almost like a hernia, right? Yeah. Anybody that's had a pregnant wife or a woman that's been pregnant has seen that during the pregnancy. It's a natural process there, but it's a progressive thing that in terms of if that's not corrected, eventually that will start to happen in somebody as they age, if that makes sense, if the patterning is off and they load it hard enough.
So what's the mechanism for that? Why would that happen outside of pregnancy? Because I think you can see kind of how that might benefit you, but
where does it happen? So what happens, what we're looking for in a normal pattern, as I said, when you sit forward, let's go through normals versus first. So when you sit forward, I can feel the rectus musculature and I can feel the oblique musculature, and I should feel even firing on the side, and you can feel I'm digging not very nice. Yeah. And so that's one of the ways we actually start to activate. We'll talk about in the next videos. But if I feel in between the rectus, if I feel that dome up or push up, or I feel inhibition right here, or no firing, or I can put my hand right under their back, those are all positives, right? Okay. The obvious positive is you see the doming, the diastasis actually form. So, excuse me, again, what that means to me, the red flag for me is that when you go through a movement and you try and get stable, when you fire, if you're not getting rectus firing, then the body's going to compensate, and you're going to overreact through the lumbar spine, the paraspinals, and you're going to overreact through the rectus musculature. And so when that happens, I always use the example, if you take a stack of coins and you squeeze down on it really hard, what happens to the coins?
You push them out. If they're
going to go. They're going to go in a direction, right? Yeah. And conversely, if you take an egg and you squeeze it all the way around, if you put equal pressure on it, nothing happens. So if I'm for instance, like old school cueing was the hyperextend, right, and then go through a squat, for instance. Yeah. When that happens, if I can't centralize that pressure to the spine, then that pressure is going out. It's going to start creating separation. Okay. Does that make sense? or the deconditioned older man that has extra weight and things like that. That'll happen naturally. So it's really a matter of bad pattern and then stress and time, right?
And so if you see that diastasis, you can assume that we're not getting firing in the.
Yeah, it's a huge red flag. It's a couple other red flags we look for, and this is actually a big predictor for listing or scoliosis in the spine, is that you'll see one rib that you can just get your hand under and the other one sits flat, right? So if you see that, especially with like children, that's a huge red flag. If you've got kids and you see the one rib sticks out when they run around in the summertime, get them screened out, because that's the faster you catch that stuff, the better to fix it. Okay. If you see that in an adult, they're going to have a harder time getting organized in terms of their core mechanics and fixing this. So the term for this is called abdominal discoordination. Everything is confused, right? You've gone into a compensation to do it. Okay. So this is the very first thing we'd screen is, can you get this in a good position? Because as soon as I start going into a hip mechanics, if I don't have good mechanics here, something to anchor the hips to, it's really going to be hard to fix. Okay. You follow me?
Yeah.
So that's one of the very first things we'll see. The other thing we oftentimes see is, while we're doing that, if we have you brace down tight, push your belly down tight, and a lot of people have seen this before, but if you can oftentimes see the people that complain of chronic hamstring tension is typically a core mechanics issue. Okay. You resolve this, and they instantly gain space. And one of the screening tools that we had learned many years ago was get them in an organized position and then retest it, and you'll see the improvement. I mean, immediately, 15 degrees a lot of times.
So if I'm totally relaxed, you're testing hamstring extensibility, and then you're saying that can be limited if I'm not even.
And I show this to patients all the time. Get them in a good position, and then you retest it, and all of a sudden they gain 15 degrees.
Wow. Okay.
Okay. So again, like a lot of times when that's a complaint of, I got such tight hamstrings, we don't stretch the hamstrings. We fix their core mechanics, strengthen their hamstrings, and you watch them gain huge amounts of mobility without doing any stretching.
Okay, that's interesting.
So, second one, let's just go through an overhead squat.
Yeah.
So, there's different ways to teach this, and there's lots of models that have already been well organized. But like the NASM has a fantastic model that's been organized, looking at motor patterning. Okay, so if you just go straight up, feet shoulder width apart, go ahead and face the camera so they can see. Okay. So go ahead and squat down deep. Good. So I always use you can come on up. I use the toes to nose or nose to toes model, meaning that start one direction and go through step by step so you can start picking out abnormalities. So, for instance, if I start from your toes and go up, we look at foot position. Did you have to, number one, did you have to turn one foot out with an asymmetry? Gotcha. Or both feet are pretty excessively externally rotated, right? If there's existing knee injury, like a meniscus, a lot of times you're going to need a little external rotation so you don't bind that up if it's not been corrected. So, but is it excessive or is it pretty much neutral? Meaning, is it within 15 degrees of straight? Okay. Then I would follow up. Let's go ahead and go slow down. Then I'd watch the knees. Where do they track? Do they start fluttering in, crash in? Right? Is one side an asymmetry? But I want to watch that. I should see the knees. On most people, they should be tracking outside the foot or at least over the top of the foot. Okay. And again, that would be looking at a lot of that is hip mechanics. One last thing on the feet. This typically works best with no shoes, so you can see a collapsing arch and stuff like that as well, right? Then going up into the thoracic spine is essentially, are you folding over, right, or are you hyperextending?
Yeah. So what you see that, right? Like
best from the side.
You're coming down. Effectively, you can see somebody coming.
And yeah, absolutely. And then, or are you hyperextending significantly? And then the nuance, I always talk about like the 2% where you get the biggest change in somebody, right? Especially with an athlete. So a lot of that we look at. We also I like a hands-on screen with that. So go ahead and get in the side, and I like to be able to put my hand on the sacrum up to the lumbar spine, and at the same time, go ahead and come on up. I like to put my hand on the ASIS and up by the rib. And I want to see how you initiate. So when you go and start to initiate that squat, good, and you maintain neutral, that was really good. But you'll start to see the nuance. Does the person initiate by going into extension and go down, right? Or do they go into flexion and start to go down? Because you can't fix that in the middle of it. You have to fix the initiation. And that might be the one thing that you have to fix on that person to take care of 80% of their problem.
I think what you're saying too is, and you mentioned it about being the old school kind of philosophy when I first started coaching, the cue that we were taught was shut the car door, right?
Right.
Squat, which is exactly what we don't want to be doing, right? We're just hyperextending,
Yeah.
putting load on that lower back, and then squatting again. So I think
Yeah.
it's a very important tool as a coach, even as an athlete, if you're focusing on, are we first just, going here and then squatting, or keeping it neutral?
Right. And if you do have film, not everybody's going to have film. If you have film, you can start seeing some people, they really should, right? If they've got a really shallow sacral base angle and a really shallow lumbar spine, they're going to put themselves in a safer position by getting an extension.
Right.
So that's the detail, that's that 2%.
Right.
But it takes more involvement. For simple screens that people can look at and apply, you're exactly right. You're best to stay neutral until you got better information.
Okay.
Another cool screen that I like to do is go ahead and sit on the table. So your feet all the way, and so your feet are off the ground.
Okay.
Go hands up like this, and then you're just going to march in place with your feet, just raising them up. And what we're looking for is, can you maintain a central position, right? This works best with no shirt on, and it's really good from behind, because you'll see the opposite side. If I'm going to raise my left leg, my opposite side, my right side, the lumbar spine is going to drive to that side. So a lot of people have heard of the term lower cross, which is kind of being washed out. It's an older term. But this is a big red flag for lower cross, meaning, am I stabilizing to my pelvis, and can I raise my hips independently? Or do I actually try and create stability through the opposite side, the contralateral side?
Gotcha.
Does that make sense?
Yeah.
Yep. What's the application for that? Well, every time you're running, every time you're doing any type of single leg movement, you're getting all this accessory, noise in terms of movement in the pelvis. That's going to have impact. It's going to chew up joints.
Yeah. And I think if we continue to drive this point home of the small nuance inefficiencies in our movement, you can get away with it for years, depending on how small it is. You can get away for months, depending on who it is. It isn't until the pain starts showing up or the dysfunction, that we're starting to say, okay, what has been wrong for so long?
Right.
And then on top of that, to take that next conversation, it's people ask all the time, well, how much before I start seeing relief? When I'm going to get better? I'm like, dude, how long have we been doing this thing? It might have been 10, 20 years. So you're not fixing something overnight. So it is a long-term iterative process for most people.
I want to give something to add to that, because there's been really cool stuff with this. That they find that if, for instance, if you tend to bias towards extension and then movement, and same thing with this, you'll tend to see it when they look at SEMG, that you have to, SEMG is looking at muscle activity,
okay.
Right? So they'll take electrodes and look at pattern, measure pattern, and what they'll tend to see is whenever you do anything, when I reach out and shake your hand, I have to create a pattern of firing that should stem from proper core mechanics all the way through the scapula to the hand, right? Okay. And they see a bias towards that. So I use the example, like if I'm going to take a step and that's my pattern, I'm going to hyperextend every time I take a step. So when you look at it, where you're beating yourself up, it might not be the gym. It's like everything you're doing is just kind of feeding that pattern. So resetting it takes time. The gym is the best way to actually fix it.
Yeah, using it as the lab effectively to see what that.
This is better than any rehab setting, because once you can activate properly, once you know what the problem is and you activate properly, if you apply those mechanics to fitness, you're always going to win faster, right?
Yeah.
The easiest patients are the people that work out, and you can tie stuff into their fitness. Yeah. One more screen looking at this, because we looked at a little bit of, well, actually flip this way. I want to show what this looks like.
With this off?
Yeah, that'd be great. That'd be great. So when you're watching that, when somebody's marching like that, you'll actually see, go ahead and raise your right leg, and you'll see the spine tend to torque from one direction to the other, laterally flex, and when they're really unstable, you'll see a lot of rotation. So this is also just an easy activation pattern, like an exercise, is that you work on creating abdominal pressure and just sitting there marching back and forth and trying to get rid of all the noise possible, get rid of all the extra motion possible, staying as rigid as you possibly can, right? Okay. And again, like when we talk about training, where training can start to hurt is if I'm always training closed chain movements, meaning everything's fixed, right? Like if I only squat and I only do the same squat, that could start to create an imbalance in a healthy person too, correct?
So so talk to a little more about that, because I think that's interesting.
Yeah.
The difference closed and versus open.
Well, if a closed chain would be something it is in fact closed. So both feet would be on the ground. So where you could start to add some complexity and start working on creating, maintaining balance would be like a Bulgarian squat or something like that, a lunging posture. But you got to keep the mechanics the same. You have to know that, because if all I'm doing is in the same plane, I become specialized. It's more easily understood if we talk about like golf. Or baseball. If all I do is this movement, everybody's like, yeah, I get it, you're going to create an asymmetry. If all I do is this movement in different planes, I'm going to create an asymmetry. So being able to learn to stabilize against every plane, meaning flexion, forward planes, side planes, and rotational planes, it's vital. It's vital. And what we tend to see is all of us get in habits and we like to do certain things and we forget about that, right?
Yeah. And I think that's really important too, because it ties into what the model of, especially the CrossFit model training, the model training we focus on is variance, functionality, and intensity, right? So we say, specialization is for insects, which is a phrase that's been used before, right? Most of us aren't competing in powerlifting tournaments or going for the Olympics. We're trying to move pain-free, keep up with our kids, be healthy, be ready for what we say the unknown, the unknowable circumstances of life, which is the model of training that you need variance and not only metabolic pathways for energy creation, but different planes, different modalities, and different movements altogether, which is
none of us play pro sports, but you look at it like a pro athlete or even the competitive powerlifter. If in your off season you're fixing what competing does, right? If you watch a pro baseball player, much of their off season training is going to be hygiene. It's going to be to offset the fact that they do the same movements all the time, because if they don't do that, their career length is less. So our career length to be fit is life, right? So you have to keep doing that stuff because you don't get an off season, right? And that ties into jobs. I mean, if you're sitting at a desk all day, a friend of mine coined the term occupational athlete. So freaking true. If I'm sitting at a desk all day, I'm creating motor patterning, I'm changing motor patterning towards this function, I'm creating spinal molding towards this function. If I'm not constantly doing stuff to offset that, you're going to become specialized, and the more specialized you become, the shorter your life expectancy is in that. Does that make sense?
Yeah.
So I want to go through one more thing, because the rotational stuff is a big deal with this, and so we're going to look at lunging, right? So if we look at a lunge, it's going to be a lot of the same mechanics. So whether you go overhand or overhead, if somebody's not stable enough, they can go down. But go ahead and do a forward lunge with one of your legs and stay put. There we go. And a lot of the same things we're looking for. This is where you really start seeing instability. So you'll see the knee quiver, crash, come way forward, right? So again, when we're looking at that, is there stability in the feet, or is it really tying from the hip, or is it tying from the core? And we can start to see, with the combination of these things, you'll start seeing consistency with a pattern, right? Yeah. So if I'm always seeing the knee crash, and I might just have some really bad glute activation stuff, and I might have a really clean high bar back squat from a distance, right? But then we can start, when we talk about activation stuff, we'll start saying, well, this is where we bias, get that person cleaned up, right? The likelihood is it's going to be a combination of core mechanics and hip mechanics, but.
And it's a good point too for being in the gym, either you're coaching or as an athlete. That's, for instance, today we have reverse lunges in the front rack position for load. However, if you can't stabilize a body weight lunge,
fix it.
You shouldn't even be playing in that space. I'm not going to load you on a max effort barbell lunge. Let's fix and focus on that, which I think is a hard concept for a lot of people to understand, especially when they come in and they see what's on the board, like, I'm going to do that, or I saw what those guys are doing on YouTube, I want to do that, and it's like, we're not there.
Fix the pattern.
We can power through that, we can keep throwing load on you, but if we don't fix that pattern, it's going to happen eventually. The system will break down eventually, so it's easier to just fix it now as opposed to trying to fix it later.
Absolutely. So one last thing is that we looked at activation stuff with that, but then you can also you look at a little bit of mobility stuff. Okay. So when you're looking at like the overhead squat and the person's folding over, is that really maybe a hip mobility issue? Is that is it a calf mobility issue or ankle mobility issue? If they're folding, is there a thoracic mobility issue, meaning they can't get into extension? So the one last thing I want to go through is a fantastic thoracic mobility screen. So this is a wall angel screen that is looking, it's really a combination of things. We look at you can look at some of the coordination stuff we looked at with abdominal coordination. So I want to see, can you flatten your lumbar spine against there? Then can you flatten your thoracic spine? And then can you retract your chin back and maintain a flat position against there, right? Now, again, knowing what people's spine looks like, some of this can be a great rehab exercise. Some of it is not. The last of the nuances with it, though, are now what am I doing in the shoulder right up here through the upper trap? So if I'm maintaining a lumbar spine that's flat, is the upper trap screaming or is it nice and relaxed? We should be able to pack that scapula down, right? And so again, if you can't get there, there's a process to fixing this that you can use this as an exercise, bringing the feet away and starting to take baby steps. But if I'm seeing that and you're really, really restricted, a positive to me would be the person gets their lumbar spine flat, which is the first priority. Their arms are stuck here and they're here. And the only way they get back is they're doing this stuff and they're teeter-tottering through their thoracic spine, right? That doesn't mean they're necessarily have hyperkyphosis, meaning too much curvature, but it does mean they got crappy mobility, and that's going to create problems as well.
Yeah.
Right.
Yeah, we see that chronically with that upper back rigidity.
Yeah.
Cool. All right. Let's. Is that pretty good for the screening stuff? You got anything else?
I think we're pretty good. I mean, that's a good fast screen that most anybody can do. So.
Yeah. So we're going to take those tools and then we're going to tie that together. Once we're going to in the next video to be okay. If we did the wall angel and we saw what the dysfunction, how do we then solve that problem? Right? How do we jump into mobility?
Cool.
Cool. All right. See you next time.